Your microphone is muted by default. Votre micro est coupé par défaut. Please use the chat to ask a question or make a comment. Kim Morris will be monitoring the chat throughout the session. Thank you, Kim. Si vous voulez utiliser le chat pour poser une question ou faire un commentaire, Kim va surveiller le chat tout au long de la session. Merci beaucoup. You can also use the hand-raising feature to let us know when you want to interject, speak, and that is, of course, during the question and answer periods, which you will see after each panel has spoken. You will then be unmuted. Vous pouvez également utiliser la fonction de lever de la main pour nous signaler que vous souhaitez intervenir et prendre la parole pendant les périodes de questions et réponses. Votre micro sera alors rétabli. There will also be 3 opportunities for you to answer questions. So there will be 3 questions which will pop up in the chat and they will show up. You'll notice that something has shown up there and it will occur during the session. We will ask you to answer these 3 questions. Participants that answer all 3 questions will be entered for a draw by Spark Employment Services for a nice prize package. I have no idea what the package contains. Au cours de la session, nous vous demanderons de répondre à 3 questions. Vous allez voir les questions dans le chat. Les noms des participants qui répondront aux 3 questions seront inclus dans un tirage pour un prix de Spark. Thank you, Spark. Your time is valuable. I will be firm with the timer for both the panelists who have 10 minutes each. I will flag them at 9 minutes and the agenda as a whole. Votre temps est précieux. Je serai très ferme sur la minuterie, autant pour les panélistes que pour l'ordre du jour dans son ensemble. Et je vais faire un petit flag aux panélistes à la 9 minutes. Alors, we're going to get started by learning a bit more about our 3 panelists. You've seen their names in the agenda. And so I will read a short bio pertaining to each one, and I will do the same again for the second panel. First, we will hear from Rob Barnett. He is the Director of Capacity, Access and Flow for Ontario Health and is responsible for emergency management and capacity planning for Northern Ontario. Prior to that, he was Senior Research Associate, Health Systems with the Center for Rural and Northern Health Research. Rob has an extensive background in health data analysis and has benefited from a career leading health intelligence, home and community care, and health education efforts in the North. He was the inaugural Ontario Health Team Fellowship for the Muskoka and Area OHT in 2021. Rob is a PhD student at Laurentian University and is an active faculty member with the Human Sciences Division of the Northern Ontario School of Medicine. A proud husband and father to 2 boys, Rob is also an active member on his son's school council. So you get to learn some little tidbits about their personal lives as well here. Then we will hear from Reggie Caverson. Reggie has been the Executive Director of Workforce Planning for Sudbury and Manitoulin for the past 11 years. In this role, she's responsible for the operation of the district office, all budget, planning, staffing, and reporting requirements, preparation and distribution of the annual labor market report, as well as working collaboratively with the board of directors. Prior to this, she was the Pan-Northern Lead and Provincial Drug Strategy Coordinator for the Center for Addiction and Mental Health. Reggie has extensive experience and knowledge in leading research initiatives, system integration, and partnership projects with senior-level business, labor, education, and government leaders to address current and forecasted labor market issues and shortages. And then we will have, and this will be en français, Diane Quintas. Depuis 2004, Madame Diane Quintas œuvre au sein du mouvement Santé en français dans le nord de l'Ontario afin d'améliorer l'accès aux services de santé pour les francophones. Elle a débuté comme agente de développement de le Nord-Ouest pour le réseau francophone de santé du nord de l'Ontario, Réseau du Nord. Elle procéda rapidement au poste de directrice adjointe et ensuite au poste de directrice générale. Dans son rôle comme directrice générale du Réseau du Nord, Mme Quintas a joué un rôle prépondérant dans la création du réseau du mieux-être francophone du nord de l'Ontario, RMEFNO, et sa nomination comme entité de planification pour le nord de l'Ontario. Mme Quintas occupe le poste de directrice générale au RMEFNO, un organisme qui œuvre pour l'amélioration de l'accès aux services de santé pour les francophones dans le nord de l'Ontario. Membre active de la communauté francophone, elle porte maintes portes au niveau local, provincial et fédéral aux organismes qui œuvrent à l'avancement du fait français. Diane possède une maîtrise en psychologie et elle parle couramment le français, l'anglais et l'espagnol. Madame Quintas est une fière franco-ontarienne qui demeure à Thunder Bay, avec son mari et leurs 2 enfants. Thank you for those very interesting bios. And we're going to jump right in for our first panelist, who will be Robert Barnett. Please go ahead, Robert.
Thank you so much, Giselle. Merci. Just as my presentation comes up, in lieu of a land acknowledgement today, I will just acknowledge that we're all treaty people, and I pay my respects to elders past, present, and future. So my role today is to talk a little bit about health human resources from the perspective of Ontario Health and Ontario Health North. My role with Ontario Health North is Director of Emergency and Capacity, so my focus is going to be somewhat time limited, somewhat immediate when it comes to health human resources. So there will be that bias in my presentation as we go forward. Next slide, please. Next slide, please. Oh, there we are. So as everyone around this table is likely aware, Ontario Health is a relatively new organization that was created from an amalgamation of 20-some provincial agencies before. My focus is primarily on the work of legacy LHINs. So I'm working with Northeastern and Northwestern Ontario to manage emergencies, including pandemic, emergency room closures, things like that. And of course, capacity planning with a focus on health human resources. Next slide, please. It's been an interesting time to start a new agency. As everybody knows, the pandemic has really taken a toll on folks, both within the healthcare system and folks utilizing the healthcare system. But our focus has shifted as time has gone on, and we've gone from immediate sort of disaster management, if you will, early on to some proactive planning. I'm looking forward to sharing that with you. Next slide, please. Ontario Health has tried to structure its response to healthcare stabilization into 5 buckets or 5 directives, if you will. It's called the 5-point plan, and you can see them in front of you here. First and foremost, we're looking at preserving hospital capacity. Secondly, we're looking at providing the right care in the right place at the right time. Third, we're looking at reducing surgical wait lists. Fourth, we're looking at easing pressure on emergency departments. And fifth, we're looking at expanding our workforce. Now, though there are 5 different categories here, it's acknowledged by everyone that health human resources underpins all 5 of these different directions we're taking. Next slide, please. So, in the context of those 5 strategies, which have a longer term window, if you will, or horizon, we find ourselves sitting in a place of relative crisis in the healthcare system. We see that right now we're in the middle of the fall surge, where we've got emergency room presentations for cough and fever, 250% normal. Our kiddos are really suffering from this. We've got lots of pediatric visits as well. But what's interesting, at least from a numbers point of view, is we're now able to quantify not only the long-term HHR shortages, which are exacerbating the situation, but also we're starting to look at short-term shortages, and that is staff absences. You can see on this graphic, we have about 17% staff absence across the entire system in Ontario, which is monumental to overcome. Next slide, please. And why do we have these? As I've already mentioned, it's because of the triple threat and the surge. On your far right, you'll see respiratory admissions for Ontario, and you can see the respiratory admissions are far, far above average. Next slide. How's that impacting us here? These are inpatient beds for kids in Northeastern Ontario, and you can see that our larger institutions are heavily impacted with regards to kids coming in for admission. North Bay Regional Health Sciences, North Sioux Area Hospital, and Timmins all showing significant impact of the respiratory surge on pediatric admissions. Next slide, please. And I've already spoken about the ED volumes. We can see a steady uptrend in terms of kiddos who are presenting to ED with complaints of cough and fever, far above normal. Next slide. So this is the context in which we talk about health human resources. I was very surprised to find that existing estimates of the total number of vacancies in terms of temporary absenteeism across the province of Ontario in healthcare is in excess of 200,000 people. 209,252 is the current estimate, or the estimate from last week. In Northern Ontario, we see, or Northeastern Ontario, we see approximately 900 folks who are currently off sick or off either for COVID reasons or for other reasons. What's telling to me from these statistics is that COVID, or active COVID, is only the thinnest slice of the reason why people are away from work currently in Northeastern Ontario. Only 81 of the roughly 900 absences we've got currently. So our HHR efforts need to dig deeper into those reasons, other reasons for absence, whether it is long COVID, whether it is burnout, or other issues. Next slide, please. So looking at estimates of vacancy rates by profession, we have immediate vacancy rates in Northeastern Ontario, and this is for the hospital system, folks. And we have systemic vacancy rates. As you can see, our immediate vacancy rates are around 20% or above 20% for family physicians, specialists, and NPs, but none of the numbers are good. Running a system on where you have 10% and up vacant positions is problematic, as I'm sure everybody agrees. Next slide, please. Looking at those vacancies specific to acute care, nursing and PSW, the acute care numbers, which we've got a good handle on, you can see that we've got a overall workforce gap of about 12,900 people and a systemic gap of 5,400. If we take those numbers and we extrapolate out to look at folks who are actively employed in long-term care, home and community care, and CSS, add that into the acute figures, we come up with a rough figure of about 22,200 head count that we are missing in the system right now, and about an 11,400 head count that we are missing systemically in the system. Next slide, please. So what are we doing in Ontario Health? Yeah, Birgit, I see your question. We can share parts of the PowerPoint, so we can do that afterwards. What's Ontario Health doing to help deal with this issue? They've got longer term strategies in place, looking at bringing in more internationally educated workers, increasing retention across the province, looking specifically at the issues in long-term care with regards to recruitment and retention for nurse practitioners and PSWs. And of course, we've got a whole lot of critical health human resource programs that are running full tilt quietly behind the scenes in the province. That is like bringing in healthcare learners to access externs and things like the emergency department locum program and so forth. Next slide, please. But if we look at some of these things that we've done to build capacity and their impact to date, they are having an impact. You can see that thousands of positions have been affected by our various programs. However, there's still a long way to go as the proportion of workforce gap that these programs have addressed so far.
And 1 minute to go, Robert. You're doing great.
Thanks. I think I have one slide left after this. So we've only addressed a slice of the issues to date. And my last slide, please. So in the context of Ontario Health and ongoing emergency management, and which is my role, we continue to try to maintain the core business or core services in Ontario Health or system in terms of ED closures. We continue to fund and support the testing and treatment centers for COVID-19 and influenza-like illness centers to prevent folks from getting ill in the first place or deal with their treatment outside of hospital segments. And we continue to work with our healthcare partners around identifying HHR gaps to look at new and appropriate funding for the context of Northern Ontario healthcare. Thank you.
Thank you very much, Robert. And we will be able to address questions in between the two panels, including pertaining to how you will access this entire session perhaps later. I will now introduce Reggie Caverson. Reggie, if you're ready, please go ahead.
Good morning. Thank you again for the invitation. It's really exciting to be here today. After listening to Rob's presentation, I want to say, Houston, we have a problem. We definitely have a problem. We have some really serious concerns around the health human resources capacity. And I just want to touch on a little bit of who we are and what workforce planning does and what we're trying to do and how we try to help communities. So I'm going to just kind of turn it to more localized information around the Sudbury-Manitoulin areas. So again, I'm the Director of Workforce Planning for Sudbury-Manitoulin. And for those of you who don't know, there are 26 local boards like us across Ontario focused on what's happening in local communities. And we are funded by the Ministry of Labour, Immigration, Training and Skills Development. Just so that you're aware, because it's so important. And as Rob points out, when you look at the Ontario picture, it's very hard to start to extrapolate that for our local community to see what's actually happening. So our primary function is to take a look at research and analyze labor market information. We work with a lot of community partners, from a variety of industries. We work with not only health and healthcare, but also taking a look at other industries such as mining, construction, retail, tourism. So we're looking at that entire picture to see where things are going and what's happening, where the labor shortages are. And although it's not relevant to this session today, but we just did a construction survey to take a look at where their labor shortages are according to the employers. We're also looking at a mining survey, taking a look at how innovations are going to impact on the workforce. And I think that's something that might be for the future in terms of how innovations and technology may assist us in the future in the health human resources area as well. I do want to touch on what labor market information is, though. As mentioned in my bio, I worked in the healthcare sector for a very, very long time. And if somebody had said to me,
Reggie, your screen has.
I'm sorry, pardon?
Your screen froze for just a few seconds, so.
Okay, I apologize. Am I available now?
Everything is good, and we'll extend your little 10 minutes by about 30 seconds.
Okay, my apologies. I'm not going to say who I'm connected with, but I seem to have problems once in a while with them. So as I mentioned, I worked in the healthcare field for a very, very long time. And if you would have said to me, the importance and value of labor market information, I would have looked like a deer in the headlights. I wouldn't know what that meant, because when you're in your occupation or in your job, you're really focused on your job and you're not focused on the larger picture, health human resources, unless you're in HR or unless you're experiencing labor shortages. So when we talk about labor market information, that includes all the reports and studies and stats that's out there. We look, for example, at tax filer data, census data, Canadian business counts data. We conduct some of our own research. So we're looking at a whole range of resources that can help us, or if they're not available, we do our own research. So we look at what's called labor supply and demand. So what are employers needing and what is available out there. We look at our local economy, what's happening. Of course, COVID had a significant impact. But as Rob mentioned, it really just accelerated what was already happening. So COVID was kind of a benchmark point, but it really didn't change the fact that these things were already happening. We look at employment rates, what's happening in terms of emerging and future labor trends. One of the interesting things that we often don't talk about is the fact that our working age population is aging, and we will not have enough people to fill all the roles that we currently have. So that's something to keep in mind. We look at what businesses are growing, declining, where the jobs are, and the skills and qualifications that are needed. So if you could pass it on to the next slide, please. So in keeping with this, as mentioned, we do a lot of our own local research. And several years ago, I was asked by an agency that was experiencing or were aware of the fact that there were a lot of shifts that were missed by personal support workers right across our area. And at that time, they had called me to say, like, what can we do about it? What's the issue? At that time, it was in January, just before COVID hit. They said that across our area, 5,000 shifts had been missed with personal support workers. And you saw from Rob's chart, they seem to be a group that has a lot of gaps and a lot of shortages and missed work for various reasons. So we were asked to find out what was happening. So we did survey personal support workers, and we had just under 100 personal support workers respond. And we asked them questions like, what did they like best about their job? What did they like least? And we thought that was important to really understand that approximately 90% of the people that responded said that they wanted to care for people. That's who they are. They want to care for people, which is very refreshing and very positive. They want to work one-on-one. They want to work in an in-demand job. Obviously, you go to school, you want to be able to become employed shortly thereafter. And we found that in speaking to a lot of personal support workers, they viewed being a PSW as kind of a pathway to other health careers.
Just give me my little lean thing and all.
I'm sorry, did I freeze again on you?
No, you're fine, Reggie. We were just hearing some other chatter in the background. So if everyone
Okay.
can remember to be muted except for the speaker, thank you.
Okay, thank you. I just want to make sure I'm not freezing again. But what they said they liked least were the difficult clients. Because not every client is wonderful to deal with, and some of them are in extreme pain or extreme distress or in the throes of a chronic disease. But they felt that what they liked least was working with difficult clients. The compensation has been inadequate in a lot of cases, and work was precarious, meaning that you had to work in 2 part-time jobs to cobble together a full-time work. And that they also, when other staff were not coming to work, there was a lot of pressure on the PSWs that were available to do all the rest of the work. So if you have to look after 12 patients, clients, residents, finding that if one of your PSWs out of the 3 are missing, then the workload falls on your shoulders. And I just want to mention, there was a really good CBC article yesterday that it's worth taking a look at, and it was interesting. They said that in this one long-term care facility, they were getting funding to shift away from task-based care all the way up through their system, and to take a look at, do we have to get everybody up at the same time? Do we have to feed them at the same time? And they wanted to take a more human-focused approach and engage residents or clients in a far more engaging way, so that they felt that they were part of the facility. And it seems to be paying off quite well, but there was a cost to it. And it's something just to consider in terms of how, like any one of us would want to be cared for. As Rob mentioned, there's a lot of health workforce challenges. The impact of COVID has certainly created burnout and increased demand. And again, it was not a catalyst for the problems that we were already experiencing, but it really brought to light the problems that we were experiencing. We also know that our population is aging, and Rob and I have this discussion with Ontario Health, the fact that we are an aging population, and we haven't really built in those aging trends in terms of the care that is required in specific areas. Attraction, recruitment, and retention right across the spectrum, health spectrum, has been extremely challenging. And you saw from Rob's slide, all the way from physicians to personal support workers to everybody across the system. And attraction, recruitment, and retention has been challenging. And although we've looked at international opportunities to look at internationally trained people, there's a lot of difficulty harmonizing credentials and all sorts of other requirements so that somebody can work at the standards that we expect in Ontario. There's also a need for a lot of additional care supports. And I think that's why this forum is extremely important today, that there are more options. For example, the program that Spark will talk about, we need additional supports to make the system work. Next slide, please. So when we took a look at the healthcare workforce needs, when we looked at specifically at personal support workers, I'm not sure if everybody's...
I will say 1 minute to go time.
Okay.
Thanks. You're doing.
Thank you. So we, a lot of times people don't realize we work with codes for every single occupation. So there are 2 codes that fit into kind of the personal support worker area, but you'll see that neither of them are included in the titles of these codes. So home support workers, housekeepers, and related occupations, and you can see where they primarily work, and nurses, aides, orderlies, and patient services. And those codes are really important because that's how we see where the numbers are at. So the next slide, please. It's my last slide as well. Just wanted to draw your attention to a job board that we have on our website. And I took a look at our job board to see how many of those not codes appeared over the last little while. On average, we get about 3,500 new online job posts. That's all occupations every single month. So these are new online local jobs. And we have about 1,700 employers in our area that are posting jobs. And in the last 6 months, when you looked at home support workers, housekeepers, related occupations, we had anywhere from 95 to 122 jobs posted each month. And for nurses, aides, orderlies, patient service associates, we had between 39 and 73 jobs posted each month. And I want to say these are only jobs that are posted online, and it isn't all the other recruitment methods that employers are using. So again, I think today's session is extremely timely and really important to start talking about other kinds of supports that we could use in our healthcare system.
Thank you very much, Reggie. That's very informative. And we will move on to our third speaker. Je vous présente Diane Quintas. Alors Diane, si tu peux commencer, allez-y.
Bonjour tout le monde, merci pour l'invitation. For the interest of this presentation, I will present in English, and I seem to have lost my notes, so sorry, just give me a second. I just have to find them again to get out of this full screen thing. I was all ready to go to. Okay, so I will present in English just so that everyone does understand. So what I'd like to start with today, obviously I'm here to present the landscape of Ontario as it relates to French language services in the Francophone population. So if you can go to the next slide. Ontario has the biggest Francophone linguistic minority population in Canada. So we're looking at 54% of Francophones living in a linguistic minority situation live in Ontario. And that's compared to 24% in New Brunswick and 11% in Manitoba. So we're looking at 637,190 Francophones living in Ontario. So that's about 4.5% of the population. And this is the latest census data of 2021. This number includes the inclusive definition of Francophones, which was developed in 2009 by the Ministry of Francophone Affairs, that says all Francophones are included are those that have French as their mother tongue, as well as people whose mother tongue is not French or English, but who use French at home and have a particular working knowledge of French as the official language of choice. So that includes many immigrants coming to Canada who have French as their official languages over English. In the Northeast, we're looking at 116,660, or 21% of our population that is Francophone. And that varies across the Northeast, as you can see on this chart, from 6.3% of the population in the Algoma region to 43.7% in the Cochrane region, Sudbury region, 50,000 Francophones, 20%, et cetera. In addition, the proportion of Francophones in the 65 plus age bracket is higher than the general population in Ontario and in the Northeast. So 26.5% of the population, the Francophone population, are in the 65 plus age bracket versus 21.4% of the non-Francophone population. So why is this important? Well, certain populations, as we all know, are more vulnerable if they don't get services in their language. Rob talked about kids, they're a huge one. The immigrant population, people living in crisis situation, people at the end of their life, and the elderly. Elderly are more likely to use the healthcare system. They're more likely as a Francophone to not have a second language. We're looking especially in the north where workers are coming to work within the forestry industry. They work in the forest with their group. They're all Francophones. They don't need to learn a second language until they need to hit the healthcare system, and they don't have the language there. And the elderly are also more likely to suffer from diseases such as dementia, where language is lost. So if they do have a second language, often that second language is lost. Language barriers have a significant impact on access to care, quality of care, patient satisfaction, and most importantly, patient safety. Therefore, it's super important to talk about French language services and health human resources when we're talking about our healthcare system. Next slide. To give you a general idea, in Ontario, we have what's called the French Language Services Act, which was last amended just last year. And this act stipulates that all government agencies or organizations that offer services for the government in one of the 27 designated areas must offer services in French. So here on this map, you'll see there are only 26 designated areas, and that's because the latest one was designated just last month, which is Sarnia, and they're not on this map yet. But a designated area means an area that has more than 10% of the population that's Francophone or has more than 5,000 Francophones in their area. So for us, what that means is that all of the Northeast is a designated area, with the exception of Parry Sound, in which only the municipality of Callander is designated, and Manitoulin Island is not designated. So in healthcare, services are not offered by the government, as you know. They're not offered directly by the government, but through funded healthcare providers. So in order to ensure access to service in French, there are providers that are identified or designated under the French Language Services Act. So a provider is identified as being required to offer French language services by the ministry through recommendations of Ontario Health and us, the planning entity. And then that means they're to work towards their designation under the French Language Services Act. In a perfect world, what that would mean is that Francophone clients would be directed to identified and designated providers to receive their services in French. We don't live in a perfect world, and that's okay. We're working on it. In order to be designated, there are 20 criteria that providers need to meet, but the biggest part of their designation is their health human resources plan. And within that plan, they need to identify which positions need to be designated to offer services in French. And the reason I'm telling you all this will come later. So just so we know, in the Northeast, we have 41 designated agencies and 49 identified agencies. There's also 2 designations that are pending approval by the ministry, and 1 provider that's working on submitting their designation this year. Next slide. So as we talk about health human resources, which is the next part. We've talked about the Francophone population, we've talked about legislation. So now we want to talk about system capacity. And when I talk about system capacity, I'm talking about capacity to offer services in French. When we hear that there's just not enough health human resources, it's true. And it's especially true in the North, and it's especially true post-pandemic, or not post, we're still in the pandemic, as a result of the pandemic. And the issue is obviously doubled when we're talking about health human resources that are capable of offering services in French. So not only do we not have enough, we don't have enough that can offer services in French. So when we need resources, what are we going to do? We're going to get resources, and we're going to stop thinking about that French language capacity, unfortunately, because the first person we can get in to serve the clients is what we're doing. And this is problematic, as I said before, because language barriers have a significant impact. So each healthcare provider is required to submit an annual FLS report. And through these reports, we have access to data surrounding HSR capacity in designated, identified, and non-identified providers funded by Ontario Health. And I'm going to show you now a brief analysis of the data around system capacity, specifically for PSWs since 2017. So next slide. This data here is for Ontario, with the exception of the GTA. So 11 of the 14 LHINs represent this data, and we've excluded the GTA, and I'm not going to go into the reasons for that. So we have a total of 4,366 HHR in the capacity, or in the category of PSW. Of those, 26% of the positions are designated, and 79% of those positions that are designated are filled by equivalent full-time Francophone capacity, etc. The next slide. What we also know is that there are 408 designated positions that are not filled. So that's a huge number. It's in individual, not just full-time equivalent, but all numbers. And that there are 309 extra HHR with FLS capacity that are designated and identified providers. So what that means is that, say the organization has 10 designated positions, they have those 10 are filled, plus they have an extra 5 that are also able to serve in French. And we also know that there's 832 health human resources that have a capacity to offer services in French in non-identified identity. So PSWs represent the profession with the greatest capacity within non-identified providers. And that's definitely something to think about and consider when we're working to finding solutions to meet the needs of Francophone patients. Next slide. If we look at the numbers from the Northeast, what we know is that there are 10,770 HHR positions in the Northeast, and 32 of those positions are designated, and 76% of those are filled. And on the next slide, what we have is a table that shows the gaps in terms of designated positions. And the third one down you'll see is personal support workers, where we have 129 positions that are not filled for personal support workers. Next slide. So just to let you know a little bit of work that we do at the FSO, we work with Ontario Health, we work with the health service providers that are identified and designated. We also work with health human resources post-pandemic. Damn it, I'm not going to make it. Okay, so then what I'm just going to say here is we've created a training program that we offer to health human resources that help them learn about the importance of French language services. Next slide. And we're continuously working on this and just yesterday, we launched our latest module, which is on immigration and within the Francophone population. Next slide. And some of the results that we've had is that 6 providers in the Northeast have attained 100% staff completion in the training. And that includes Ontario Health North and HCCSS. Nawson University requires all students admitted to the program to complete the training. The next step of the plan is to ensure that faculty and staff do that. And they also worked with us to create a primary care module. And we're also looking at home and community care support services to add the training to all employees across Ontario, which is over 9,000 employees. So what this work is doing is helping individuals, helping organizations, helping health human resources recognize the importance of offering French language services, but giving them tools and solutions in how to do that.
Thank you very much, Diane. And
yes.
We will move now to the question and answer period. And we will pick up the panel discussion again in 6 minutes. So looking through for questions. So one of the questions that came through was about the ability to receive the PowerPoint slides after the presentation. And perhaps, Chantal, could you make a comment about availability of the presentation?
Absolutely. Thank you, everyone. I will be connecting with the panelists, and the PowerPoints portions that are available to share will be shared with everyone who has registered, as well as the recording. We are recording this session, and that will also be shared with everyone.
Thank you very much, Chantal. And I'm seeing that right now there are no other questions. If I could verify, Kim, are you seeing any other questions that have come in right at this moment?
Not at the moment. Also, if you want to use your hand, like I've just done, if you have a question, we can identify you through that way.
All right, well, we can perhaps use these very few moments.
There is one question.
Okay.
Camilla.
Camille.
Yes, sorry, Camila. I'm not sure, again, if this maybe might be addressed in the next series of panel questions, but a question that I had, because we brought up a lot of stuff around, obviously, attraction, recruitment, and retention, I think being a really big piece. Is there a way that people are engaging kind of youth in the conversation around what is making them want to either go into the different fields or stay in those fields, maybe why they're choosing to then pivot and change what they're doing after entering that field, and then also what are kind of alternative education pathways or non-traditional pathways that we're exploring.
Thank you, Camilla. Chantal, could you make a comment about that?
Yes, thank you. Thanks, Camilla, for the question. Yes, I'm hoping we can address a little bit of that in our next series of panelists, but you will see that we are definitely open and engaging with youth, and we hope that the programs we are putting forward are enticing to youth and really trying to create those pathways that you speak of for individuals who may not be sort of certain as to which pathways they'd like to take. We are looking at ways to introduce them to the healthcare sector and connecting with our partners to ensure that whatever they can complete here with us here at Spark leads into other opportunity, educational opportunity, into other positions in the healthcare sector. So definitely hoping you get a little bit more of that in our next series.
Thank you, Chantal. And we have just a few moments. Another question. At the conclusion of the meeting, somebody is asking about getting a list of attendees' names, titles, and organizations. Kim, perhaps you can help us with that question?
I think it will depend on whether or not people do want. If anyone does not want us to share their contact information, please send us an email indicating that, or to me directly in the chat, Kim Morris. I see that Reggie has her hand up as well, I think, to add to what Chantal had indicated as her answer.
Thank you, Kim. I did want to just address a little bit of what Camilla was asking, and there have been a lot of efforts to try to engage youth, and there seems to be very little interest. We've been working with school boards and the colleges, even with free programs that are being offered. It's been hard to get people enrolling in those programs, even if they're free. There's all sorts of different strategies that have been looked at in terms of graduates and other nursing programs that were not able to complete their exams, to have them kind of bridged into the PSW role. That's been limited success. And there are efforts to try to engage youth now, and even in placements, for example, in their healthcare schisms in high school. So that maybe some of the placements could be in long-term care or working with older adults, just to get them exposed, because family structures have changed and young people are often not exposed to all the challenges that are there. And some go in and say they absolutely love it, and some just don't want to do that kind of work at all. So there have been a lot of efforts. I'm going to say not a lot of success yet.
Okay, and maybe Reggie, sorry, we could talk offline a little bit after, talk more about kind of, because we do a lot of the youth engagement piece, and maybe that's a connect that's missing.
Great, thank you.
Thank you very much to everyone who's asked a question and our responders. The questions that are currently in chat, we will address those first in the next component of Q&A after this panel.
I can answer one very quickly for if Laurentian, Cambrian, and I will add Collège Boréal in there, have been approached to discuss gerontology, yes. And a lot of that will come out in the next panel as well. And I think that the next question might be addressed as well in the next panel. Sorry.
All right. Thanks very much, Kim. So I will now share with you the bios about our next three panelists. And I'll start with Chantal Makala. Chantal is the Chief Executive Officer at Spark Employment Services. She is a driven and motivated visionary leader with extensive experience leading operations, projects, and staff in the social services sector. Chantal holds a bachelor's degree in sociology from Laurentian University, as well as a diploma in travail social, gérontologie from Collège Boréal. She is also a Northern Leadership Program graduate and is Lean, Greenbelt, and Volunteer Administration certified. With over 2 decades of management and community service experience, Chantal is not only a CEO, but a chief of vision and inspiration. She is a dedicated advocate for improving the lives of barriered and marginalized communities and loves finding ways to make everyone's day just a little bit better. When she is not leading a government-funded employment services agency, Chantal can be found camping, spending time with family, creating art, or volunteering in her community. Told you they would be very interesting. Then I'll tell you about Nicole Blais, who is, her passion is, she's the founder and president of Goshenite Senior Services, and her passion is providing care and support for seniors. This calling first started when she worked as director of care at Breeze's retirement residence and grew while serving as executive director of Easter Seals, Ontario. In 2019, Nicole founded Goshenite Senior Services Incorporated, and add publisher to the list of hats Nicole wears. The 50+ Lifestyle magazine just celebrated its 6th year anniversary and greater distribution through Northeastern Ontario. Giving back to her community is also top of mind for Nicole. She is involved in many different activities. For example, she launched a Mother's Day card campaign for seniors in long-term care facilities during COVID, as well as a very successful stocking for seniors. In May of this year, Nicole was awarded Fearless Business Award of 2022 by Paro Enterprises. Despite her very busy schedule, Nicole remains steadfastly devoted to husband Mo and grown boys Alan and Matthew, as well as her fur baby, Sophie. And thirdly, Jocelyne Leclerc. Jocelyne Leclerc œuvre dans le domaine de l'éducation depuis 1992, donc 30 ans. Elle a débuté sa carrière comme enseignante d'éducation physique et enseignante des sciences au secondaire de 1992 à 2009 à diverses écoles, par exemple l'école secondaire catholique L'Héritage et l'école secondaire du Sacré-Cœur. De 2009 à 2018, elle accepte le défi de conseillère en orientation. Par la suite, elle devient direction adjointe au Collège Notre-Dame. Depuis septembre 2019, Jocelyne relève le défi à Carrefour Option Plus comme direction. Ses passe-temps incluent la lecture, le crochetage et passer du temps avec sa famille, spécialement sa petite fille Zoé. So those are the very interesting bios, and I will ask Chantal to kick us off and get us started with her presentation. Go ahead, Chantal.
I knew someone would do it, and it was me. I was still muted. All right, so good day, everyone. Thank you for being here. Thank you, Gisette, for the introduction. It is such a pleasure to be here today and to see actually so many interested in joining our conversation and really collectively looking to see what role we can all individually play in leading solutions to address this crisis we speak of today. So I'm here today to share with you a little bit about who Spark Employment Services is, and more specifically, details surrounding the implementation of our new Care Companion for Seniors program, as well as the intentions moving forward, which hopefully will answer some of the questions we've heard so far. So firstly, Spark Employment Services is a nonprofit organization incorporated in 1986. For those who may not be familiar with our organization, we were established originally as Project 2544, which was a project designed to reintegrate males between the ages of 25 and 44 receiving social assistance back into the labor force. Now, through the years, we have grown, changed our name, and expanded our reach by delivering programs at all levels of government. Most recently, in 2019, we rebranded from Sub-Revocational Resource Center, which we were most known for mostly for the most of our existence, to Spark Employment Services, a name that we now believe better represents who we are and what we do. Spark for us is the initial flicker of hope in each of us that evokes change, which we assist in igniting here at Spark. And today, our organization delivers an array of employment and skills development training programs funded both provincially and federally. Our vision here at Spark is for a dynamic and prosperous community, a community where everyone is able to participate in the labor market as they intend. And our focus is to support individuals with motivation, reliability, dependability, and to really help people create that space in their lives to include work. As we know, we are living through historically complex times, which, as we heard today, has significant impacts on our economy and on our community, the labor force, and more specifically on each and every one of us. So throughout the pandemic here at Spark, it was really important for us to continue to uphold our mission and deliver employment and training opportunities and serve its client effectively, and focus its energy on finding new and innovative ways to engage and to support the challenging needs of both job seekers and the employers. It was through it was through that lens and commitment to our community that the Care Companion for Seniors program was born, and I'm so excited to share a little bit more about that with you today. So Nicole, who you will hear from shortly, approached us, and together we had some great conversations and really truly took the time to understand the needs she was presenting and her goals as an entrepreneur. And it was through that conversation it became very clear to me that together we had the ability to play a role in co-creating a solution that could and would have a positive impact on the healthcare crisis we find ourselves in. And so I invite all of us to perhaps extend ourselves and identify what part we can play in co-creating solutions together. So Goshenite had the experience of developing and the role of Care Companion and having people in that position already. They were in the business of delivering frontline services and also had the capacity to offer practical experience for future candidates. Now, while we at Spark here brought to the table the experience and structure required to build a program, deliver a program, support job seekers, and explore new career options and connect with community partners to create pathways to employment. So together we formed this power team in creating a new option that lends itself well to filling the gap in healthcare sector. The Care Companion program is a 6-week comprehensive training that includes 4 weeks in class component and a 2-week practical. The program is designed for individuals currently working or wanting to pursue employment as care companions for older adults. It also is a great opportunity to introduce people to a potential career in healthcare, as well as for folks who have taken or plan on taking on the role of care companion for a loved one, therefore equipping family and friends with the skills to take care of each other and reducing some of the burden on the system. The program includes general employment skills training, as well as specialized healthcare and service training designed to give participants the required skills to gain employment as care companion. So the 4-week in-class training is broken down into 5 different sections, each section is having approximately up to 6 modules. The participants complete the in-class portion with a solid comprehension of things such as understanding the role of care companion. It's really important for them to understand that the role and the activities that they engage in may differ depending on the environment. For example, the difference between long-term care, retirement, and or community. They leave with healthcare, health and safety requirements, so understanding health and safety for themselves as an employee, as well as client safety. Communication in healthcare environments, so understanding and having better skills in person-to-person communication, communication impairments and related strategies, and as well, and let's not forget, documentation. Providing care and comfort is another section. And in this section, we have modules on dementia, mental health, physical disability, end of life care, and supporting for grieving. Following these 4 weeks, participants then engage in a 2-week placement with Goshenite, where they are provided with hands-on workplace training and coaching as they apply the skills they've just acquired. So by the end of the 6 weeks, participants graduate with the skills and knowledge to take on the role of care companion and be included as member of the healthcare team. To date, we have graduated 2 cohorts. We are currently working with our 3rd cohort and they're finishing their placement this week. And we've had some successes thus far. I'm very happy and proud to report that 60% of our graduates are working as a care companion at this time. And the others who are chosen not to work as a care companion had identified that this was something they wanted to expand their own personal skills in order to best support their family and friends. Our intentions moving forward is really to grow the partnerships we have currently built and to explore new partnerships and really create those pathways. So we're really working closely with our education partners, St. Albert's, Baradone College, Cambrian, Boreal, Laurentian, to identify those opportunities for the laddering opportunities so that the care companion can be seen as a stepping stone into further education for someone who now wants to explore other careers in the healthcare field and perhaps move into PSW. We're also looking to explore micro-credential opportunities, so different programs we can offer here at Spark that would introduce individuals into the healthcare sector. So truly what the Care Companion for Seniors program is doing is opening doors. It's allowing folks a way into the field of choice and really providing them with the skills necessary to work and expose themselves to supporting the needs we've identified today. So before I end, I would like to share that the next group begins this Monday. It is online. We are exploring delivering the program online. So registration is open for anyone who might be interested. There is no eligibility criteria. So if you know someone who would like to participate, all they have to do is give us a call here at Spark and we will connect with them and register them. We are committed to growing this program and currently seeking funding to expand the Care Companion and also add additional micro credential opportunity in different healthcare programs to be delivered here through Spark. So we're open to discussing future partnerships. So if you're interested, please connect with us and let me know. And I will end it there and leave it to other panelists. So thank you very much for your time today.
Thank you very much, Chantal. And I think there'll be some questions and comments pertaining to what you've shared with us in the Q&A section. And I will now introduce our second panelist, who is Nicole Blais. And excuse me here, yes. So Nicole, if you can please take it away for us.
Sure. Good morning, everyone. Bonjour à tous. Thank you for having me. I'm happy to be here amongst the other panelists. So I'm here to talk a little bit about the Care Companion program. So as Chantal mentioned earlier on, back just before COVID, we were getting a lot of requests at Goshenite about having someone attend to families' needs and older adults' needs in the community. So hence I began doing some research and found that a care companion would be suitable to assist those calls that we were receiving. So a care companion in the community is something very different, looks very differently than what a care companion's role is in a long-term care home or in a retirement setting. For example, in the community, when we receive calls about care companions for a family, it can be as simple as taking the loved one out on a walk or even playing games with them, a sing-along. Those are the care companions we were getting in the community. So for me, also, because I have worked in the healthcare field for many of years, we also all identified that there are crises in the healthcare sector, not having enough PSWs or RPNs to accommodate the requests either in a long-term care facility at the hospital. So for me, I wanted to take a different approach, basically going back to basics. And what did that mean? So for me, that meant starting at a high school level, excuse me, and approaching those people who are graduating in grade 12 that might be interested in a healthcare career, but not exactly sure if they wanted to become a PSW or an RPN. And how could we introduce them to a career where we are constantly, you can tell by Robert's numbers and Reggie's numbers that the decline in the interest in the healthcare career are constantly getting, they're lower and lower all the time. So to me, this is good news because this allows for a care companion to step into some training and possibly be interested in moving their career into a PSW role or right to an RPN role, and working with the post-secondaries and getting those things accredited as a care companion will provide the opportunity, the vision that I have for the Care Companion program. So in developing the Care Companion program and working with Spark, Chantal specifically and her team afterwards, to get the program funded and get it up and running, we were very successful. And as Chantal mentioned earlier, the numbers are very good. I have focused on growing with long-term care facilities, retirement homes, and in the community, having care companions work on their at these sites. So I'm happy to say that we've attained some contracts and that is about to unfold. So where Care Companions could have a full-time position, either in a long-term care facility assisting a PSW or in a retirement setting, taking on that role. So for the training that they are receiving as Care Companions, it is specific as to, as Chantal spoke about, the modules and what is being taught in the classroom as well as in the practical. So for anyone interested in taking a Care Companion program, I would highly suggest they contact Spark or contact myself, and we will connect you with Spark Employment, or give you some, if you're looking for information on how to become a Care Companion, please reach out to either one of us. And I want to just say a few words in French, que le programme de compagnons de soins il est délivré en français aussi sur ligne. Récemment, on va dérouler ce programme. Et puis, pour nous contacter, soit moi ou Chantal encore, pour l'intérêt, si vous avez de l'intérêt aux compagnons des soins. Merci.
Merci beaucoup. Thank you, Nicole. And we're picking up some time, which I think is going to be very valuable here in the discussion. And I will now introduce and open it up to Jocelyne Leclerc from Carrefour Options Plus.
Bonjour tout le monde. Good morning, everybody. I'd like to thank you for giving me the opportunity to speak about the programme de préposé aux services de soins personnels qui va débuter le 3 janvier à Carrefour. I'm going to speak a little bit in French and then I will continue in English. Donc, le Carrefour Options Plus, c'est une école d'éducation permanente où les élèves ou des adultes qui désirent obtenir leur diplôme peuvent venir chez nous et continuer leur apprentissage. Et donc, le programme de PSSP pourra leur fournir l'opportunité d'obtenir leur certificat de PSSP en plus d'obtenir leur diplôme. So basically, as a mother of a nurse, daughter who's a nurse, we talk a lot about like the needs in the community. Unfortunately, I missed the information in the first panel because I am at a conference in Toronto at the moment, discussing actually the PSW program. So we are going to implement the program as of January 3rd. It's been a long process. It has not been easy because of lack of resources in French. That was one of our biggest challenge. Now, for the PSW program, as I said, it's for someone that has wants to have a career, or even an adult that would like to get their diploma and at the same time get their certification to become a PSW. So the requirements are pretty basic. You need to be 18 years old to be able to participate in this program, as well as if you don't have your diploma, you have to have at least 16 credits, therefore your grade 9 and 10 credits. Or if you have your diploma, you're also eligible to take the program. Now, the program itself will be delivered on site at our school. We have a classroom designated for that. And we are also having a partnership with St. Albert, where we will be using their specialized equipment because it is so expensive to start up the program. So we are very grateful for the English Catholic School Board to allow us to use their specialized equipment room to be able to at least have our students practice their skills before they go into their placement. So it's nice to see that Chantal and Nicole are also pioneers or leaders in our community to try to get some help out into our community because as you know, there is a great need, but especially in French. That's one of the things that I have some friends that work into the field, and because we are in a French community, you know, Chelmsford and in sub-region and in the Valley, there's a lack of PSWs in general, as you know, but there also is a lack of PSWs in French. So we are hoping to be able to assist with that need in offering this program. So like I said, the program itself will be starting on January 3rd. The program is approximately 6 months, 3 months into class. Therefore, the students are going to be reviewing or learning 14 different modules. And while they are doing these modules, they will have basically four days of theory and then 1 day of practical where they are going to be practicing specific skills that they will learn during specific modules. And afterwards, students will be able to go into different community placements as well as long-term care placements where they will do over 330 hours. And what is nice about this is these students, even if they have their diploma, are also going to get credits towards their official transcript. Therefore, they get 3 credits for the in-class portion, and then they get 3 credits. It's considered a co-op. Therefore, they come out with the program with their certificate as well as 6 credits in their pockets. So when they do their placements, their first 100 hours is supervised by the nurse in our region. And then they have an opportunity to do a second placement in long-term care and a third placement of over 100 hours in the community. Therefore, they will be exposed to different needs in the community, maybe even have possibility to get employment, get some people where they can have some connections. But as most of you have already said, there is definitely a great need for PSWs in our region, and the fact that they will be bilingual will be an asset for them. Definitely, the fact that they speak French and English, that's one of the main criteria also is students that do come and take our program do an evaluation beforehand, and one of the criteria is that they do need to be able to read and write in English, as most of the charting and information is done in English in those institutions. Therefore, we are making sure that these students will be successful in their placements. Again, I appreciate the time that you have given me for promoting this program. I know that there's a great need, and hopefully we will be able to help out also with students that are going to be taking the program with Nicole, compagnons de seniors, and help out our community as much as we can. Thank you.
Merci, Jocelyne. Thank you very much, Jocelyne. Now we're going to open it up for discussion, Q&As. And first, Kim, if you could check with me for in the chat, any questions that we want perhaps to go back to.
Giselle, I think I just want to add a little something in regards to, because what Jocelyne just highlighted, I do want to say that there have been discussions with St. Albert and Carrefour Option Plus, as well as Boreal and Cambrian colleges, in regards to PLAR, prior learning assessment or reconnaissance des acquis, so that a student that has successfully completed the Care Companion program could get credits toward the PSW certificate afterward. So it's a genre of laddering, so that if you're a Care Companion, you also have the opportunity to work and get additional credits so that you become a certified PSW. Afterward, also, we know that the community colleges do have the some laddering towards the practical nursing, alors soins infirmiers auxiliaires, so that it's kind of the foundational base to be a Care Companion, and then you can actually build upon that. The sky's the limit in terms of, practical nurse to a registered nurse, maybe, a nurse practitioner, you never know. So I think that it's important to know you don't just have to stop at Care Companion, and those talks have begun. We have undertaken the discussions with those partners.
Thank you very much, Kim. one of the questions, I'm going back now to where we were in the first Q&A section. Somebody has asked, I think it was Birgit Pianosi, has Laurentian University and Cambrian College been approached to discuss gerontology programming and education to prepare the workforce of the future? So a little bit similar, but perhaps, Kim, do you have some thoughts on that, or should I be moving over to someone else for that one?
There, there is, and I want to add, Boréal does also have a gérontologie programme en français. So there have been absolutely discussions with Laurentian, and Cambrian and Boréal. Now, there was also in the chat that NOSM does not have a component of gerontology, but for many of the gerontology programs, I know I can talk a lot about the one at Boréal because that's where I was, and it's a post-grad. So you don't, you know what, it's a part-time and mostly online learning, so that it's easily accessible.
All
and
right.
we're also looking at, sorry, she said, micro-credentialing that Chantal talked about. The micro-credentialing would be, we could do gerontology micro-credentials as well.
Kim, I would just like, or Giselle, just like to clarify my comment about NOSM. It's not a required part of the medical school training. So there are some optional courses that are available, but pediatrics, for example, is required. Gerontology is not. And I did ask the school about that not that long ago, which is extremely disappointing to me because we are an aging population. And as a result, even firsthand experience I've had with how physicians respond to older adults has been, in many cases, not very good because they don't have that connection to older adults. So it is something that I am concerned about. And that's why I did note that NOSM does not have it as a requirement for their students.
Thank you, Reggie. The next question we're seeing is, can somebody address the use of the private sector to meet the gaps? Now, I'm wondering if that has been addressed by the presentations that we have just seen. I'll bounce it back to you, Kim, to make a comment about.
Well, I'd like, actually, I'm wondering if the person who asked the question, sorry, is it?
Mary Beth.
Mary Beth, do you, the information that you heard, it kind of talks to it, but did you want to ask any further clarification?
Okay, so that's great, and we can come back to it as necessary. The next question was, let me just see here on my, okay, reasons for leaving healthcare services. I think we did see that in one of the presentations.
Also, Kim, I just want to mention that Rob and Reggie have their hand up.
I didn't see that. So let's go to Rob.
Sure, thanks. Just in the context of the previous question around private care and its use to fill the gaps, there has been a large upswing, as many people around here know, with regards to private care nursing, private care PSW in northern hospitals and rural hospitals in northeastern Ontario. Just to put it in context again of our existing emergency management, there is a whole lot of attention being paid to the role which private care is filling within our healthcare system and cost benefit analysis with regards to nursing in particular, and it's the impact of agency nursing on our hospital system. So I just thought I'd share that with you.
Thank you, Robert. That's very helpful. And Reggie. Perhaps, Reggie, your question.
Sorry, I muted myself. My apologies. Just very quickly, that is the reason why we did the PSW survey, because a lot of the long-term care facilities were, while they were desperate for additional workers, particularly PSWs, They said that it was just putting their ballooning their budgets beyond compare to what they were before, and that was an extreme challenge. And also from the staff end, we were hearing that staff were saying they didn't have the continuity of care because a staff member would parachute in to fill a shift and didn't know the residents or patients, kind of jumped in, jumped out, weren't part of the workforce team. So that was a real challenge for them as well. And I just want to mention the other question around leaving the profession. Our PSW report does have a lot more detail about why some people were leaving the profession. And as I mentioned in my presentation, it has to do a lot with the amount of work, the compensation, the lack of compensation, part-time precarious work, and a lot of other things, heavy lifting, that kind of work. So the report does touch on some of that as well.
Thank you very much, Reggie. And I see Lynn Dupuis has her hand up. Allez-y, Lynn.
Merci beaucoup. Bonjour tout le monde. I'm just very happy, first of all, to see faces that I recognize that I haven't seen in a little while. So hi, everybody. I have two questions. So one question is, how will these new positions or these new care companions, will they help to support or become a gateway to having more PSWs, more nurses, or will it create kind of like a gap, an additional gap, because these people are going towards this free education like a position and taking up, maybe they could have gone to other positions as PSWs and so on. Are you seeing it as a benefit or as removing somebody who could have been going as a PSW or a nurse, and instead they're going as a care companion? Does that make sense? And then I'll go to my second question after.
Oh, okay, Lynn, an excellent question. Maybe I'll ask Chantal to jump in, and there may be someone else who wants to jump in on that same question before we move to the second one. Chantal, can you please share your thoughts on that first?
For sure, absolutely. Thanks, Lynn, for the question. I can share that currently folks who are attending Spark and who are exploring the idea of taking on the Care Companion program are actually individuals who were not considering a role in healthcare. So to answer the one question about, do you think we're removing folks from entering a PSW career path? I would say no. I would say, in fact, we're encouraging the Care Companion program so that there's future consideration into PSW. So I believe at this time, because the folks we have seen, and because we have removed the barriers to attending the Care Companion program by not necessarily requiring your high school diploma and so forth, which may be barriers to taking on a PSW or another position or program in healthcare. So at this time, I would say that's not something I've seen.
Thank you, Chantal. And I see a few more questions are coming in. Will, is that?
Can I add to that, Gisèle?
Yes, allez-y.
OK, merci. Bonjour, Lynn. Pour ajouter, le rôle des compagnons des soins, c'est nous autres, comme une agence, Gauchonnette, soins des aînés, c'est pas que on avait de la difficulté à trouver des PSW pour commencer, OK? Mais le rôle de compagnon de soins, moi, mon expérience et notre agence, l'expérience de l'agence, ça l'ajoute à la domaine de santé. So, c'est pas que ça l'enlève ou que les personnes qui prennent le programme ou qui sont déjà impliquées avec nous comme un employé, ça améliore l'opportunité qu'ils deviennent des PSW à l'avenir. And as well as Kim talked about and Chantal spoke about the layering, the micro-credentials, also as a care companion, you can be in that role and start doing, once the micro-credentials are put into place, start adding those layers as well to become a PSW. You're still working, you're still getting paid. It's not like you have to end one career, go into another career and not get paid or collect EI. You have that opportunity to do both as a care companion, the layering program, and become a PSW while you're still working. So to me, it's not a negative. It definitely adds a positive spin to entering that next level as a PSW or an RPN working in the career already. Do you have anything to add to
Okay.
Kim?
Thank you, Nathan.
I think if I can just add, I think that also because I've had the pleasure of meeting the cohorts, the 3 cohorts, and the folks, like Chantal said, it is not people that necessarily wanted to get involved in healthcare. Et puis, on voit les gens qui potentiellement, c'est des jeunes personnes âgées, retirées, qui veulent faire quelque chose pour aider leur communauté, faire un petit peu d'argent aussi. Et so we're seeing those newly retired people wanting to get involved. Also, a lot of people are reticent about the whole the personal care that a PSW would have to undertake. Mais nous voyons vraiment un changement, puis je pense que c'est un ajout. Quand tu parles des plus jeunes candidats qui suivent le programme, Lynn et autres gens, c'est que eux autres, je vois, parce qu'il y en a une comme celle-là, oh my God, est une superstar, mais elle a eu un petit peu de défi dans sa vie et elle est début trentaine, puis je verrais qu'elle serait une candidate parfaite pour ensuite continuer et devenir potentiellement une infirmière autorisée. Puis c'est que là, elle a pu avoir le boost et puis la chance avec le programme.
OK, c'est bon. Merci, Kim. Lynn, si tu veux juste attendre juste une seconde. Lynn, just be on hold. I do want to have us answer another question, and we'll come back to you, Lynn. Joanne Brousseau had a question. And Joanne, if you can go ahead and share your question.
Not necessarily a question, just to say to you guys, I am not in the health field. I am a daughter of a 94-year-old who lives at home. I can tell you why you're losing PSW community care workers, because you don't pay them to travel. We had a good one at the beginning. I know Leanne's on. Anyway, my mom's in the downtown core of North Bay. She would spend time with my mom, then she left and drove for half an hour at the end of Peninsula Drive Road, took care of a lady for half an hour, and then drove back into town for half an hour. So during that hour and a half, she's only paid for half an hour. That is, and so they're out there for 10, 12 hours if it's a snowy day, but they're only getting paid for 8. And the paycheck is not what we should be giving them for taking care of our parents. I am a secondary caregiver. My sister's a primary. She lives with my mom. But right now, my mom is assessed for 21 hours a week. We're only getting 12. So I'm the plug-in. Maybe it's a good thing I lost the municipal election, but because right now we get a phone call, worker's not coming in, and I got to step up. My mom cannot be left alone. She's a flight risk and she's a fall risk. She's got dementia. So that's the beginning. What we've been experiencing lately, so we do have 2 private, and when I say private care, they're not through an agency. It's us, we found them through recommendations, and we plug in those some hours that we can't do. We pay for that personally out of pocket. But right now we were given extra hours from a business in Sudbury, and who operates in Sudbury, but will only come to North Bay 1 day a month to train the staff. So this person showed up at my mom, a newcomer, who apparently in her country was a nurse. I gave her I didn't know this, I gave her my phone number. If you need me, I'll be back. I'm only 5 minutes away from here. She, I don't think she understood. I don't even know she knew how to operate that well, a telephone in our country. But I came back and she was about to leave. My mom was outside. She let my mom go outside. She was, the newcomers, there's nothing wrong with them, but they don't have vehicles and they rely on public transit. And in North Bay on weekends, the route only runs one an hour. So they're always coming in late. So that's no good. And for this, when we have VON or anyone else coming in, they will a new person will shadow the old employee for at least 2 weeks before they're left alone. This person had never been introduced to our house. Where's the bathroom? Where is everything? And now my mom wakes up with it and has dementia, and this is a stranger in her house, and she panicked and left. And the doors are all locked. She left the house, and this girl just was following her. She wasn't stopping her. She didn't call me. So that is very, very scary. So that is a management situation. And when we called them, it was like, oh no, we'll be there at the end of the month and we'll show her what to do. Well, I'm sorry, but that's not good enough. You have to train, you have to give orientations, regardless who you're hiring. They have to have an orientation in my mother's house. So that for me is a no-no. So now we're probably going to skip those extra few hours that they gave us and stick to the 12 hours, and my life will change drastically. So I will adapt and pull out my knitting and go and spend time at my mom's house. But
Joanne, thank you so much, because I think this is very important that we've heard from the client side of the story here.
Yeah.
And, you know, if of all of the conversations we've been having, this one we really need to pay attention to, because you've brought up an elephant in the room is the travel. So, you know, that's something for us to.
And I can tell you that my dad spent the last 6 months of his life in a nursing home. On the first evening, my sister and I were in tears and promised each other that my mother would not go to a nursing home. And we are sticking to our guns. Hopefully we will be able to. There's still probably 1 or 2 years left in her, but she is not going to a nursing home because of the experience we had then. And that was in 2007. And I'm sure it hasn't improved. Oh, I'm sorry, from my point of view. So yeah, so we're trying to make my mom as comfortable as she can in her home, but it's you guys have an issue, and you need, and it's probably, I was a municipal councillor. I was trying to become a municipal mayor. It didn't happen, but you need to advocate big time to those conservatives that you need to pay these people. And I've realized everything is based around Toronto. All decisions are made because of Toronto life, not Northern Ontario life. And I'm sure a PSW in Toronto could probably, within a block, could spend her whole day in a block, probably in 3 apartment buildings, and have so many clients. She doesn't have to. She just doesn't have to travel an hour between clients, or half an hour. So yeah, go get that funding for the traveling time.
Yeah, thank you. I think that's really key.
Yeah.
Thank you, Joanne.
You're welcome.
I'll go back, as I said I would, to Lynn, or did we address, did you have a second question?
The question is still pertinent. Kim touched on it just a little bit, where moi je travaille pour la Fédération des aînés francophones de l'Ontario, et une des choses qu'on essaie de faire, c'est encourager nos retraités de faire, pas nos retraités, les retraités en province, de trouver des alternatives, des occupations, des choses comme ça. Puis vous l'avez touché un petit peu, mais je voulais savoir, y a-t-il un grand pourcentage de gens qui vont opter pour prendre cette formation-là? Et aussi, est-ce que ça serait quelque chose qui serait intéressant à faire en tant qu'un atelier ou une présentation pour parler aux gens qui s'intéressent à nos formations virtuelles?
Okay, merci, Lynn. Who would like to share thoughts on that question?
Gisèle.
Okay, allez-y, Nicole.
So Lynn, just to answer part of your question, so just on Tuesday, I gave a presentation to le Club d'âge d'or de la Vallée. Il y avait à peu près 55 personnes qui étaient à la présentation, puis justement, c'était de discuter le programme des compagnons pour les retirer. Et la raison, c'est pourquoi que c'est pas pour eux, ils ne cherchent pas de l'emploi à plein temps. Ils cherchent de remplir une coupe d'heures ici et là. So, nous, comme une agence, tant qu'il y a une personne qui appelle pour avoir un compagnon de soins pour leurs parents, c'est des blocs de 2 heures qui sont réservés. So, ça se peut que la personne retirée veut travailler 10 heures par semaine. So, en prenant le programme et le cours à travers de Spark, c'est justement ça. C'est parfait pour eux autres. Ils veulent faire 10 heures de travail par semaine, ou ils s'en vont en Floride pour 3 ou 4 mois, puis ils ne veulent pas travailler dans ce temps-là. So, it's a perfect fit for that, for the retired person as well. And they may have already gained experience, haven't taken care of one of their loved ones already previously. So the program is, for me also, it's not just geared for the young or the middle age people, older people, retired people who retire at 55 plus. This is a great attribute, this program, for them. If that answers your question.
Thank you, Nicole. I also see a question that I'm not sure if we touched upon. Are instructors qualified to teach about gerontology? Do they themselves have education or training in the field? And perhaps somebody who is providing programming could help with that.
I can step forward. So yes, we do vet our instructors. Instructors are qualified individuals with the experience and education in the field of working with seniors. And please, we have Birgit Pianozzi, who is here on the call today, who is actually going to be the instructor for the next few cohorts. So she does have quite an extensive background in gerontology. And so yes, to answer that question, the answer is yes.
Thank you, Chantal. And I'm just sharing now that if you look in the chat, the link is now available for you to answer the 3 questions and potentially win a prize from Spark Employment Services. And while that is there and going on, and we'll be leaving it there for the remainder of the session, okay, so you can begin answering at any time now. And I will take it back over to Kim to perhaps make some comments here that will help us begin to wrap up. And any of the panelists perhaps can also jump in and share some thoughts as we're getting ready to wrap up. Kim?
Merci, Gisèle. The goal of this morning was really to share some ideas that are different, innovative things that are happening in regards to trying to fill the major crisis shortage of PSW and Care Companion assisting our most vulnerable population, which is our older adults, our seniors. Alors, je crois que c'est vraiment important que les gens mettent leur chapeau de créativité pour voir comment est-ce qu'on peut combler cette pénurie. Things are not going to get better if we don't start thinking outside the box. You've heard a lot about PSW programs, free programs. Obviously, it's not the magic answer because we're still, when I was dean at Boreal years ago, we had the free program and we couldn't fill our seats. So, and I know that it was all throughout the province. So Care Companion is a solution that can definitely segue into getting more PSWs. But if you have any other suggestions or ideas, I would encourage you to indicate it. Also, please, we do want to hear from you in regards to the 3 questions that you can answer through the chat. I don't know, I'm having some issues. I can only get 1. I don't know why that is. Perhaps it's just me.
No, Kim, if I may, so if you stay on that link, answer the first one. Jeff is just giving us some time and making sure everyone has opportunity to answer the one, and then we'll be posting the second question and so forth. So.
Okay, great. Yes, there's
Thank you.
I am seeing in the chat that some individuals, okay, yes.
Yeah, we just want to give ample time for people to be able to share their thoughts with us.
And
Linda, oui, tu voulais rajouter?
Linda Fontaine had a comment or a question.
Tu es en sourdine, ma chère Linda.
Yeah.
Hello.
Hello.
Okay, now I'm on.
Yes, go ahead, Linda.
Okay, I wanted to speak.
Linda, okay, go.
Someone was speaking.
Linda,
Right now,
peut-être si tu fermes ta caméra, Linda, ça va être mieux.
Linda, if you can close your camera and restart your comment, that would be great.
Is this?
We're getting some freezing of your screen, so it might be better with, yeah, let's try again.
Is this better?
Yes.
Is this better?
Yes, please go ahead.
Okay, I just want to speak on 2 points that were brought about us, the instructors. So yes, Birgit has was a professor at the university, and I also worked in the healthcare center for the department in the last 30 years. And I also want to comment about who is taking the course. So right now, half the course is youth and half the course are people over 60. So I'm pretty happy and proud of that because it's accomplishing both components of the youth and the seniors. That's all I wanted to say. Thank you.
Thank you. Merci, Linda. That's very interesting.
Est-ce que je peux rajouter? So, and Lynn, it's coming back to something that you mentioned. So, the Care Companion program is completely bilingual. So it's available in English and French. And Chantal, I guess I don't want to put you on the spot. Linda, can you mute yourself, please?
Pardon me?
Okay, merci. I'm wondering if there'd be an opportunity to have the online en français so that Lynn, toi tu parlais d'avoir une présentation, puis maybe it could dovetail into having an offering en français. When it's online, it's virtual. Anyone, anywhere can participate in the program. So that might be an opportunity down the road, Chantal. I'm sorry, I don't mean to to put you on the spot, but I know that Farpo have an extensive reach. They're very well respected in the Francophone older adults community, and they have quite the membership. So it might be an opportunity to extend the programming throughout.
Absolutely. Thanks, Kim. Thanks, Lynn. I think that what I want to make sure folks understand is Spark is absolutely interested in exploring any option. Right now, the program is offered in person in English. It's also being offered in French. We are trialing our first online cohort coming up. I know that I saw briefly a question, is it offered provincially? Currently, it's offered here, but when it's online, it is, open to everyone and anyone. I know through our partnership with Goshenite, they have the capability of creating opportunities for placement in various cities in the Northeast. So that's definitely something we're looking into. In future funding applications, we are ensuring that we have the resources in order to expand our offerings of the program and the practical to reach more of a regional approach. So definitely something I'm looking to explore. Offering presentation is something we can absolutely work for. So leave us your name, your contact information. We definitely reach out to you and see what the future holds.
Thank you, Chantal. I'm seeing a comment from Nicole Blais. who says that they are looking to expand the Care Companion program in Sudbury, North Bay, Timmins, and Sault Ste. Marie. So very interesting. I see that the questions are rolling. I think the second question is now up, or is this the third? The third question is now up if you're participating in that. And while we're doing that, we can proceed to next step and wrap up. Now, I just want to share that I've already heard quite a few next steps types of comments throughout the conversation and communications that are going to occur and new linkages. So do any of our panelists have any comments to add pertaining to next steps?
Thanks, Giselle. I'd like to start. First of all, I just want to say thank you to everyone who was here today and participated. Please take a moment to answer the questions we have up for you. If you're interested in having a conversation with myself or any of the panelists, leave us your name and your contact information. I will certainly reach out and make those connections and initiate those conversations. There's a lot of great information shared today, and there's definitely a lot more opportunity for us to be innovative in our community. And so I open, sort of that link for us to have that conversation. As next step, as I shared already, we are making applications to expand the program. We're also looking at building new opportunity, new training opportunity, new micro-credential opportunity, and having the conversation with our education partners so that there is that opportunity to build a career in healthcare, and seeing Care Companion as that first stepping stone into that, so that we can be of support to our system. So thank you very much, and I hope you really enjoyed this session, and I look forward to the future.
Thank you, Chantal. And that sounds like a wrap-up comment to me. Again, thank you very much. And I think there'll be a lot of very interesting discussions happening from this. I have a feeling it won't be the last time that this group comes together to look for solutions. Thank you very much. Merci beaucoup à tout le monde. And the questions have all been there. And that link, will it stay open if people are still... Okay, so the link with the 3 questions will be open for the next hour. And Kim, if you agree, I'm going to log off, and people, I believe, have started logging off as well. Am I right, Kim?
Oops. Yep.
Okay, we're good. Merci beaucoup. Thank you, everyone.
Merci, Giselle.
Merci, Giselle.
Super job, Giselle.